Hello and welcome to the National EMS Academy's lesson on the female reproductive system. In this lesson, I will discuss the anatomy and physiology of this system, and I'll also cover the anatomical and physiological changes that occur during pregnancy. Although this illustration looks like it might be some type of horned demon from hell, it's not. For the fellows out there, it's something much more frightening. These are the female reproductive organs. So let's start by labeling the organs and discussing their function. Here are the ovaries. They are the primary female sex organs, and they have two basic jobs. First, they make the female sex hormones, estrogen and progesterone. Second, they produce the eggs that carry the female's genetic material that is donated for procreation. These structures are called fallopian tubes. Some texts now refer to them as uterine tubes. Either way, they receive the ovum or egg and provide a path to the uterus by a process called peristalsis. I talk about peristalsis in the muscle lesson. These tubes are also the most common location for fertilization when it does occur. Here is the uterus. It is specially constructed to house the developing fetus. Its muscular layout and rich blood supply will both protect the little one and shove it out into the world when the time comes. A special lining is created monthly in anticipation of pregnancy. The opening or exit to the uterus is the cervix, and it's located here. Below the cervix is the vagina. The vagina has two functions. First, it is a receptacle for the male's genetic material during the sex act. Secondly, it's the birth canal for the exiting newborn at the end of pregnancy. Okay, now that's the basic anatomy. Now let's talk briefly about the menstrual cycle. Here are some basics that you should know. First, it lasts 24 to 35 days with an average of 28. The first day of the cycle is signaled by the start of menstruation, shedding of the tissue lining of the uterus. Since fertilization didn't occur, it's no longer necessary. On the 14th day, the ovaries will release an egg. This is called ovulation. Over the next 5 to 7 days, that egg will travel through the fallopian tubes to the uterus. If fertilization occurs, then the egg will implant into the uterine lining and gestation will commence. If not, it is discharged along with the uterine lining about 14 days after ovulation. I've added this illustration to show you just how crowded things are in the female abdomen and pelvic cavities. Here, I'll label the structures. Here's the uterus. Here's the bladder. This is the vagina. And back here you see the terminal section of the large intestine and the rectum. That's crowded. And this is before you add a growing kid to the mix. Well, speaking of adding a kid, let's now review the anatomy during pregnancy. Well, obviously this is Junior right here. And there are three specialty structures I want to point out that are present to facilitate Junior's developments. The placenta. It develops after fertilization. Through this organ, the fetus will receive oxygen and nourishment from the mother. Now, there is no exchange of blood between mom and child. Instead, oxygen, carbon dioxide, and nutrients diffuse across the placental surface from one circulatory system to the other. This is the umbilical cord. It connects the fetus to the placenta. It contains two arteries and one vein. But in this case, the artery is carrying unoxygenated blood from the fetus to the placenta, and the vein carries newly oxygenated blood from the placenta back to the child. Finally, the fetus is enclosed in a bag full of fluid. The bag is the amniotic sac, and the fluid is called amniotic fluid. There's anywhere from 500 to 1,000 milliliters of fluid, which helps protect the developing fetus. Now let's do a quick review of some of the pregnancy-related terminology. The pre-embryonic stage describes the first 14 days after fertilization. At this point, the fertilized ovum is rapidly dividing as it travels to the uterus and implants in the uterine wall. The embryonic state lasts from day 14 up to 8 weeks. At 8 weeks, the embryo becomes a fetus and the fetal stage starts. The fetal stage will last from 8 weeks until delivery. The term gestational age is used to describe the age of the fetus and is expressed in weeks. For example, a 30-week-old fetus would be said to have a gestational age of 30 weeks. Full-term pregnancy is one that lasts 280 days or about 40 weeks. Finally, the term trimester is used to describe each 3-month period during gestation. There are 3 trimesters in a full pregnancy. Little side note here, most complications of pregnancy happen during the 1st or the 3rd trimesters. On this slide, you get another view of a pregnant patient. It's incredible to see how much the developing fetus has displaced all of the abdominal and pelvic contents. At this point, I have to tell all the ladies out there thank you. I'm glad you took on this job, because I'm pretty sure if men had to have babies, there'd be a lot fewer people in the world. But I digress. Let me tell you about some of the physiological changes mom goes through when pregnant. There is an increase in both the respiratory rate and the tidal volume to support increased oxygen needs. Heart rate and blood pressure both increase. There is also an increase in the blood clotting factors produced in preparation for the bleeding that typically occurs during delivery. There is a significant increase in gastrointestinal issues, especially nausea and vomiting. The pressure on the urinary bladder means there's a lot more trips to the bathroom. Finally, the added weight causes a decrease in lower back muscle tone, which leads to lower back pain. Pregnancy affects nearly every body system and is hard work. If your mom is still around, you need to call her and say thanks. She went through a lot to bring you here, so show some appreciation, okay? Well, that's it. See you next time.